To improve awareness of Alexander disease, it's important to include rare diseases in medical education curriculums, to promote rare disease in continuing professional development courses and seminars, to promote engagement with research and patient registries, and of course to use social media and to reach out to patient advocacy groups to raise awareness amongst the general public. So some of the biggest challenges for patients living with Alexander disease include a lack of diagnosis or significantly delayed diagnosis, lack of specialist expertise in their treatment, lack of specialist help that's near to where they live, as well as the financial burden of living with a rare disease and the lack of available disease-modifying treatments. So the differential diagnosis for Alexander disease will differ on whether you have a pediatric population or an adult population. For pediatric populations, the differential will include other leukodystrophies, of course, of which there are many, things like adrenoleukodystrophy, Krabbe's, metachromatic leukodystrophy, but also other causes of learning delay or macrocephaly in the pediatric population. For adults, it's a bit different. For adults, we're going to be thinking about multiple sclerosis, particularly primary progressive multiple sclerosis, of course, other leukodystrophies in adults, monogenic small vessel diseases, things like CADASIL, or for patients with a lot of brainstem signal abnormalities, other metabolic disorders like adult polyglucosan body disease. So when we're evaluating a patient who we think might have Alexander disease, it's important firstly to have access to high quality MRI. We also need to have access to the appropriate type of genetic testing. Usually this will be through a leukodystrophy panel that will cover a wide variety of leukodystrophy genes, including GFAP. One of the most helpful things we can do is make sure that we're working in a multidisciplinary team with other neurologists and neuroradiologists, and finally that we reach out to people who are expert in rare disease, including with Alexander disease. So online platforms like AxDimaging can be really helpful for learning about rare diseases like Alexander disease. And this is because they're accessible, they contain lots of up-to-date information from experts in the field. They have interactive case simulations and high-quality imaging, and they can be accessed remotely so that people can learn at their own pace. So in the future, for patients living with Alexander disease, I think that we'll see great advances when it comes to gene therapy and personalized medicine approaches. With much greater use of genetic testing, I think we'll see shorter time to diagnosis and far fewer patients receiving a misdiagnosis. And hopefully we'll see greater access to specialist care and advice coming from multidisciplinary teams.